A fast, safe, cost-effective treatment for varicose veins that's been offered to Cornish patients for 5 years is now being recommended as a first-choice procedure across the UK. The treatment uses heat rather than surgery under general anaesthetic. Our health correspondent Sally Mountjoy looks at a medical success story from Cornwall.
Pat Venton's been referred for treatment at West Cornwall Hospital after a varicose vein she'd had for years has become troublesome.
It's very, very hot, it's very, very itchy, and it's breaking out into sores.
So why were you told that you needed the treatment?
Because they said that the varicose vein looks like it was blocked and it needed to be done before anything further happened to it.
And back down again, thank you.
But instead of traditional surgery, like vein stripping under general anaesthetic, Pat's having a keyhole procedure that takes about half an hour and needs only local anaesthetic.
It's closing down nicely.
Endothermal ablation heats the varicose vein from the inside. A tube or catheter is guided into the vein and a probe inserted into it sends out radio frequency energy which heats the vein until it collapses, sealing it off.
Right, now you might feel a funny tickling sensation up the inside of the leg.
Vascular surgeon Kenneth Woodburn uses an ultrasound scan to guide the probe, which heats up to 120 degrees Celsius. He says the procedure's better for patients and cost-effective.
This can be done on a walk-in, walk-out basis in an office-type environment. We don't have to use an operating theatre. There's no need for a general anaesthetic. After the procedure, they wear a stocking for a week or two, and over a few days, everything tends to return to normal, and they're able to get back to normal activities, usually within 24 to 48 hours, whereas with conventional surgery, most people were laid up for a couple of weeks. Right, I'm just going to lower the height of the table, get your leg cleaned up, bandage on. Okay.
This treatment has been available to patients in Cornwall since 2008, but in the rest of the UK, many patients are offered only conventional surgery for varicose veins. Now, the clinical advisory body NICE says everyone troubled by the condition should be referred to a vascular specialist and should be offered endothermal ablation as a first choice.
Well, it is certainly a nicer experience for the patients. It's something that can be done under local anaesthetic in a day case setting or in outpatients. The patient satisfaction seems to be higher than with traditional surgery. It is undoubtedly a cheaper procedure to be able to offer. There is usually per case around about a £500 saving to the NHS.
Thank you very much indeed.
Not at all.
Thank you, everybody.
A third of the population has varicose veins. More people will now get treatment, but the NHS should save, as fewer patients will need care for the complications caused by the condition. Sally Mountjoy, BBC Spotlight, West Cornwall Hospital.